Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So as we all know that we are dealing with the 7th unit, that is vital signs. When we were discussing about this unit, we came to know that there are 4 measurements of vital signs. That is the body temperature, the pulse, the respiration, as well as the blood pressure. So in our previous session, we have also discussed in detail about what body temperature is, what are the factors that affect this body temperature, as well as the various sites which we can use in order to assess this body temperature of an individual. So from today's session, I will be teaching you about what pulse is, what pulse rate is, what are the various sites through which we can assess the pulse rate of an individual, as well as the factors influencing and the abnormalities that can occur in pulse. So without any further delay, let us start with this topic. So what is pulse? Pulse here is the palpable bounding of the blood flow which can occur at various parts of our body. And this artery will also be the one who will be nearer to that surface where we will be palpating, where we will be getting an idea of the pulse rate of that particular individual, as well as this artery is the one which will be passing over a bone. Why? Because here if this artery passes over a bone, then we will be getting a more accurate reading of the pulse rate. And how do this blood flows? So here, how will you be feeling this palpable bounding of blood flow? You will only be feeling this when the blood is pumped into the arteries by the contraction of the left ventricle. So here it is very important that we must know that the blood which is flowing in the arteries of our body, it is only pumped through the contraction of the left ventricle of the heart. So how do this blood flow occurs? This blood flow only occurs when the blood is pumped into the arteries by the contraction of the left ventricle. So you must always remember this, that it is due to the contraction of the left ventricles that the blood will be pumped into our various arteries which is present in our body. We must always remember this, that it is because of the contraction of the left ventricle that the blood will be flowing in the arteries which is present in our body. So now let's move on to the definition of pulse. So what is pulse? Pulse is the wave of blood which is formed by the contraction of the left ventricle. So here, as I have told you, that because it is of the contraction of the left ventricle that the blood will be pumped our arteries. So it is also through the arteries that we will be able to assess the pulse rate of the client, right? So here, pulse is the wave of blood which is formed by the contraction of the left ventricle. This pulse also acts as an indicator of the circulatory system. How does it act as an indicator? It acts as an indicator of the circulatory system. Why? Because here it is the one which will be revealing the amount of blood that enters into the arteries with each heart contraction. So the amount of blood which will enter into the arteries with each contraction of the heart will be giving us an idea of the circulatory status of that client, right? That is why it is said that pulse is also indicator of the circulatory status. And also this pulse rate can be assessed through various sites in the body. So in our later session, I will be teaching you about what are the various sites through which you can assess the pulse rate of an individual. Pulse is also palpable on various parts of the body. So when you want to assess the pulse rate of an individual, you can assess it through various sites. Okay, it can be through the temporal pulse, through the carotid, through the radial, through the ulnar, through the apex, and so on and so forth. So here, in order to assess the pulse rate of an individual, you can also choose which side you will be assessing or which side you will be choosing in order to perform this procedure. So why do we perform this procedure? Why do we assess the pulse rate of an individual? We do so in order to get the information of the functioning of the heart as well as the circulatory system. And not only that, we assess the pulse rate of an individual in order to get an idea of the health status of that particular client, in order to get an idea of the metabolic rate of the client, as well as their emotional status. This pulse rate will also give us an information about the client's physiological response to The blood loss, the tissue damage, the exercise, the stress, the fatigue, or if the client has or is undergoing any treatment, if the client had performed any surgery, or if the client is under any medications. So these are the various information which we will be getting through assessing the pulse rate of an individual. So talking about pulse rate, what do you mean by pulse rate? It is the number of time the ventricles of the heart contracts per minute. So pulse rate is defined as the number of times that the ventricles of the heart will be contracting per minute. So how will you be able to determine this pulse rate? You will be able to determine this pulse rate by palpating the pulse and also through electrocardiography. So you can assess the pulse rate of an individual, which is the number of time the ventricles will be contracting per minute. You will be assessing this pulse rate through palpating the pulse or even through electrocardiogram. So these are the various information that we can get through assessing the pulse rate of an individual. So now here, since we are talking about pulse rate, right? So what do you mean by pulse rate? It is defined as the number of times the ventricles of the heart contract per minute. So the number of times that the left ventricle of the heart will be contracting per minute is known as the pulse rate. This pulse rate can also be determined by palpating the pulse or even through electrocardiograph. Okay, so here it is very essential that before we assess the pulse rate of an individual, we must know the normal value. So here the normal value of pulse rate of a human being is 72 beats per minute, whereas for an infant the normal pulse rate is 120 to 140 beats per minute. Whereas if this pulse rate is assessed for a child who is 6 years of age, then the normal pulse rate will be 100 beats per minute. For an adult male, the normal pulse rate will be 50 to 90 beats per minute, whereas for adult female, the normal pulse rate will be 55 to 95 per minute. So as a nurse, it is very important that we must keep this normal value or this normal range of pulse rate in mind. So now, as we have discussed about the normal value and the normal range of pulse rate, right? So when you as a nurse, you are assessing the pulse rate of an individual and you find that there is some abnormalities in it, either it is higher than the normal range or lower than the normal range, then you can term it as tachycardia, bradycardia, as well as pulse deficit. So what do you mean by tachycardia? Here, if the heart rate of an individual is higher than the normal limit, then it is termed as tachycardia. Whereas if the heart rate of an individual is lower than the normal limit or below 60 beats per minute, then it is termed as bradycardia. What do you mean by pulse deficit? So here, if there is an inefficient contraction of the heart, in which when even you are palpating the arteries or when you are palpating the pulse rate of the client, you find that it is not palpable at the peripheral pulse site, then this is known as pulse deficit. So what happens here is that if there is an inefficient contraction of the heart, because I've told here that this blood will be flowing into the arteries through the contraction of the left ventricle into the arteries, right? So here, if the blood is not pumped towards the arteries or if the blood is not pumped into the arteries, what happens is that even while you will be palpating, it will not be palpable, then this is termed as pulse deficit. So how can this pulse deficit be detected? This pulse deficit can be detected by making a comparison between the radical pulse and the apical pulse simultaneously. And also while you are palpating the pulse rate of a client, and if you find that there is presence of pulse deficit, then this will be reflecting that the client is having an abnormal rhythm. While you are assessing the pulse rate of the client, it is very common that sometimes you will be finding that a client will be having tachycardia, bradycardia, or even pulse deficit. So now moving on to the next one, that is the physiology of pulse. So here the sinoatrial node, which is present in the heart of an individual, is the one which will be initiating the cardiac contraction. So here what happens is that as the ventricles of the heart contract, then approximately 60 to 70 ml of blood is ejected from the ventricle of the heart towards the aorta. This ejection of blood from the ventricles of the heart towards the aorta is also termed as heat stroke. This process of ejection of blood from the ventricle of the heart into the aorta is also termed as the stroke volume. After the blood is being ejected into the aorta, the walls of the heart will be distending and it will also be transmitting a wave throughout the arterial system. And this wave which will be transmitted, it will be felt in the distal artery. So what you need to do is that you just need to palpate the artery slightly against the underlying tissue or muscles. This wave can be felt in the distal artery. So as a nurse, what you need to do is that you just need to palpate the arteries lightly against the underlying bone or the muscle. And sometimes this can also be viewed on the arteries which is superficially close to the heart. And also we must keep in mind that the pulse rate and the strength is regulated by the mechanical, neural, as well as the chemical factors in the body. So this is about physiology of the heart. So what happens here is that the sinoatrial node which is present in the heart is the one which will be initiating this cardiac contraction, right? So here, as the ventricles of the heart contract, approximately 60 to 70 ml of the blood will be ejected into the aorta. And when this ejection of blood occurs, then the walls of the heart will be distending and it will also be transmitting a wave throughout the arterial system. So how will you be able to feel this wave? You will be able to feel this transmitting of wave in the distal artery. So what you need to do is that you just need to palpate the artery lightly against the underlying bone or against the underlying muscle. And sometimes you will also find that this can be viewed on the arteries which is superficially close to the heart. And also here that the pulse rate and the strength is regulated by three factors of the body, that is the mechanical, the neural, as well as the chemical factor. So this is all about physiology of pulse. And then we have come to the end of this topic. So in today's session, we have discussed in detail about what pulse is, about what pulse rate is, and about the three conditions which you may find while you are assessing the condition or the pulse rate of a client. Okay, you may find that the client may be having tachycardia, bradycardia, or sometimes even pulse deficit. At the end, we've also discussed about the physiology of pulse and how the pulse rate and the strength is being regulated in the body of an individual. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session whereby we will be discussing in detail about this same topic. That is, I will be teaching you about the various sites through which you can assess the pulse, about the factors which is affecting the pulse, about the characteristics as well as the abnormalities of pulse. So until then, have a good day. Thank you.